St. John's Wort by Sam and Joey. So what is St. John's Wort? It is going to be a plant, and it's a yellow star-shaped flower. It has 5 petals, and it grows in Europe and North and South America, Australia, New Zealand, and Eastern Asia. Who would use St. John's Wort? St. John's Wort is mainly used for the blues or depression and symptoms that go along with that mood, such as nervousness, tiredness, poor appetite, and trouble sleeping. It can also be used for many symptoms of menopause and any other conditions such as ADHD and OCD, but this still lacks good scientific evidence, and there needs to be further evidence. So the effects of St. John's Wort. St. John's Wort effects on your body are not fully understood, but are thought to work similarly to antidepressants. Research suggests that a number of its active ingredients, including hypericin, hyperforin, and adhyperforin, may be responsible for these benefits. These chemicals increase messengers in the nervous system such as serotonin, dopamine, and noradrenaline that regulate the mood. There are some side effects to St. John's Wort. When it is taken by mouth in small doses, it can have trouble sleeping, you can have vivid dreams, you can have difficulty sitting still, nervousness, irritability, stomach upset, tiredness, dry mouth, dizziness, headache, skin rash, diarrhea, and the skin of tingling. But if you have larger doses, or when it is used topically, you can have severe skin reactions to the sun. So there are some warnings and precautions to St. John's Wort. Until more is known, it is not recommended for use during pregnancy or breastfeeding, and it may worsen symptoms of ADHD. It can bring on psychosis in people with schizophrenia. Really be careful if you're below the age of 17. Can bring on mania in people with bipolar and or depression. It also might affect the serotonin levels in the brain and result in interference with the surgical procedures. It may also contribute to dementia in people with Alzheimer's disease, and it may cause infertility. There are some similar drugs, though. Many studies, but not all, have compared St. John's Wort to drugs such as Prozac, Celiac, Paxil, and Zoloft, and these were found to be just as effective. So we do have an overview of a study. The objective of the study was investigating whether the extracts of hypericin are more effective than placebo and as effective as standard antidepressants in the treatment of major depression, and whether they had fewer adverse effects than standard antidepressant drugs. The study was a systematic review, and it included trials that were randomized and double-blind. They included patients with major depression, and they compared the extracts of St. John's Wort with placebo or standard antidepressants. It also included clinical outcomes assessing the depressive symptoms. The main outcome measured for assessing the effectiveness was the responder rate ratio, the relative risk of having response to treatment. The main outcome measure for adverse effects was the number of patients dropping out due to the adverse effects. So the results of the studies was both the placebo-controlled trials and in comparisons with the standard antidepressants, findings were to be more favorable to the hypericin. Patients given these extracts dropped out of the trials due to adverse effects less frequently than those given the older antidepressants. So this evidence suggests that hypericin extracts tested in the trials are superior to placebo in patients with major depression. They're similarly effective as standard antidepressants, and they have fewer side effects than the standard antidepressants as well. So the overview of the next study is a 12-week randomized double-blind placebo-controlled flexible dose parallel group study that was aimed to examine the efficacy of St. John's Wort for the treatment of OCD patients. The patient population was 60 outpatient subjects that were aged 18 to 65 with primary diagnosis of OCD in the last 12 months of duration. The outcome measures, the primary outcome measure was the change from baseline to endpoint on the total YBOCS score. So it looked at the secondary depression was evaluated by the self-administered HAMD and the clinician-administered HAMD. The clinician and patient global impressions of change were evaluated by the clinical global impression and patient's global impression. So these were the results of the study. The mean change from baseline to endpoint on the YBOCS total score was significant for both St. John's Wort and placebo. However, the mean change with St. John's Wort was not significantly different than the mean change found with the placebo. The effect size for St. John's Wort versus the placebo was negative 0.03. There is also no significant difference between St. John's wort and the placebo on any of the YBOCS subscales, such as obsessions, compulsions, and time spent with the obsessions. So these are what we would recommend to our patients. We would say, caution, St. John's wort can be just as effective as prescription drugs in treating mild to moderate depression. However, the supplement interacts with many medications and it can cause some serious side effects. If you take any prescription medications, it is recommended to steer clear of St. John's wort. And these are references, and that is the end of our slideshow.